Dr. James Davis.
Opportunity to contribute to this debate. During the pandemic, many have turned to their MP for help, and so far nearly 800 cases have been brought to me by constituents. This has proven a challenge at times, especially while struggling with COVID symptoms myself, but it's been rewarding to assist so many people, and I'd like to thank all those who have joined me in working around the clock to provide responses. I must also thank key workers at this immensely challenging time and pay tribute to all who have volunteered to help their communities. I welcome the generous package that the government introduced to support individuals and businesses. A great number of my constituents have expressed their thanks for these schemes, and I'd like to add my own thanks for the hard work which has been undertaken by ministers, officials and industry representatives to construct these programmes. In such difficult times as these, a united approach across our country is vital. Regrettably, much of my time over the last several weeks has been spent dealing with confusion and anxiety where this has not been the case. It started with national guidance to seek coronavirus advice via the 111 service when no such service existed in North Wales. Soon afterwards, the Welsh Government was in such a rush to announce the closure of schools in advance of the UK Government that it did so without the initial mention of provision for vulnerable children and those of key workers. Following this, the very successful Good Sam scheme, which recruited 750,000 volunteers, was not embraced by Welsh Government, with far fewer volunteers being registered in Wales as a result. Then, the UK Government ploughed on with its plans for Nightingale hospitals. Precious little appeared to be underway in North Wales alongside, and working with the Health Board, 3 temporary Rainbow hospitals are now available, which mercifully have not been required as yet. Perhaps one of the greatest issues in my mailbag has been the difficulty in obtaining supermarket delivery slots, as the Welsh Government was initially unable to provide electronic lists of shielded patients to supermarkets. To compound matters, the online form to register as a vulnerable person would not accept applications from Wales. Now, shielding letters themselves were very much delayed compared to England, and it then emerged that the 80,000 shielding letters sent out by Welsh Government included 13,000 that had been sent to the wrong addresses, and only a week ago a shocking further 21,000 recipients were identified. A survey by Asthma UK and the British Lung Foundation found that while 10% of its respondents from Wales had received a shielding letter, this rose to an average of 17% in the rest of the UK. I still have many constituents yet to receive a shielding letter, such as Larry Humphreys from Rhyddlen. It's my belief that the dispatch process of shielding letters highlights critical failures in the IT systems in use in NHS Wales, which contribute towards poor performance of the system on a daily basis. As COVID testing has been ramped up in England, the Welsh Government failed to match this with access to testing still unavailable to many groups. It's now belatedly available to some care homes. The online booking portal available in England, Scotland and Northern Ireland does not function in Wales, and until just days ago, all tests carried out in North Wales were being sent on a several-hour trip to Cardiff for processing, yet to send them to the Alderley Park Mega Lab would have reduced lab transfer times to as little as an hour. Most recently, it was revealed that poor communication between the Health Board in North Wales and Public Health Wales had resulted in a failure to report all of its 84 coronavirus-related deaths over the course.
Yep, we appear to have lost James, but thank you very much, James, for your contribution.